Hello, everyone. Welcome to the IJD Podcast. We're the official journal of the International Society of Dermatology. I am Lily Becke.
And I am Anita Biro. We are the editorial managers of the IJD. In this podcast series, we'll spotlight the dedicated professionals who help shape our journal, including section editors, selected reviewers, and authors.
Stay tuned for a closer look at the people behind IJD.
Hi, everyone. I'm Lajos Kemény, the editor-in-chief of the International Journal of Dermatology. In this episode, Dr. Goldust shares his expertise on the application of artificial intelligence in clinical dermatology. Mohamad began his medical education in Iran and pursued further specialization in dermatology in Switzerland and in Germany. During his time in Europe, he conducted groundbreaking research in artificial intelligence, resulting in publication in high-impact journals like in the Lancet. He then completed the 2-year dermatology fellowship at Yale University. Mohamad is set to join as assistant professor of dermatology in Chicago, where his primary focus will be advancing applications of AI in dermatology. So thank you, Mohamad, for being with us today. And I start right now with the questions and with the statement that you are one of the most efficient section editors in the journal. Could you please share a few words about your motivation, why to join to the editorial board, and what is your feeling about this, to be a board member and to be a section editor of the journal?
Thanks for having me, Lajos, and thanks for your kind introduction. Actually, joining the IJD as a section editor of emerging technology was not difficult for me. I was involved with IST, and I was familiar with the society's mission. And my passion for technology, for innovation, especially in skin technology and artificial intelligence, drove me to accept this job. And I would love to bridge the gap between skin technology and daily clinic to integrate them in dermatology, and my passion for supporting and for inspiring young dermatologists and researchers drove me to this job.
Yeah, but if I remember well, you were also editor in one of another journal, maybe in an immunology journal, Frontiers of Immunology.
In a couple of journals before IJD, it was Virus, it was Biology, Journal of Cosmetic Dermatology, like Dermatologic Therapy, like a couple of journals I was editor already, yes.
Yeah, I see, because you are really fast, and I'm asking a question and asking, I want to assign a paper for you. I got sometimes in a few hours back the response, so it is really great, and I appreciate your help. So as a section editor for new technologies in the journal, what do you believe, what was the major breakthrough in the last years in dermatology?
That's a good question. I would say artificial intelligence, especially in the imaging, in early diagnosis and treatment of skin disorders. So with these machine learning technologies and AI, they can early detect many skin disorders, including skin cancers. In addition, with wearable devices, with augmented reality and teledermatology, now we have better options to have better access to the underserved areas. So these technologies are evolving, but we are in a good shape now also.
Yeah, definitely. We started with the AI-supported diagnosis of skin cancer, and that is the oldest. And we had used AI and machine learning techniques for many, many years ago, and now it's really working perfectly. But nowadays, there are many other options, many other skin disorders can be diagnosed using AI.
And if we combine them with human insight, I think it would be perfect in the future. I mean, we should not only rely on technology and not only on human insight. If we combine them both, I think we will have the very good options for diagnosis and treatment of different dermatology skin disorders.
Yeah, at the end of the day, we, the humans, the dermatologists, are making the diagnosis, but the AI could support the diagnosis and make suggestions, and we can accept or not accept these suggestions, but definitely that will be a huge help. So you published a lot of papers about AI. In your opinion, in which area in the patient's care is the most exciting when using AI, in addition to NIVI detection and skin cancer detection?
I would say precision dermatology. Uh,
What do you mean under precision dermatology?
So, I mean, with these AI technologies, we can analyze the large data sets of patients' images. So, and based on these images, when we upload a patient image, these AI tools can make a diagnosis and make a treatment options based on the each and every patient's characteristics. So this would be a precision dermatology, and with also teledermatology, now we have better access to underserved area. So these are very good options that we have, and most exciting part of the AI in dermatology.
Yeah, and probably AI could be a great help in writing patient report and patient letters, because AI can summarize all the laboratory data and histopath and everything and put together, and then at the end of the day we have to read it and approve it and send to the patient. So it is a really great help, and patient leaflets and patient how to inform the patient about the disease. Was a
Through the different large language models like ChatGPT, like Gemini that we have, everything is easier for us now. For example, if the patients has some question, they can go directly and ask them. They are not perfect now. It should be under supervision of a doctor, dermatologist, physician. But I think when we are going further, these large language models and other AI tools would be a great help for managing the skin disorders.
Yeah, great. Could you please a little bit talk about your own research? I know that you published a great paper in the Lancet. And what is your current interest in AI?
Actually, my research in AI is about diagnosis and treatment of different skin disorders. The project that you mentioned, it was a mutual collaboration with Microsoft and Novartis in leprosy, and we demonstrated that machine learning algorithm could efficiently and accurately diagnose leprosy in underserved area. So that was a great project. So in another project with my German colleagues, we highlighted that combining physician insight, I mean dermatologic insight, and artificial intelligence technology could accurately diagnose melanoma in Germany. So that was another project that I would love to mention. In my recent publications in IJD, I highlighted the efficacy of using AI in many skin disorders like pediatric dermatology and rare skin disorders. And also, I would love to highlight the ethical and regulatory concern about using AI in dermatology and in medicine.
Yeah, this is really great. You mentioned the app in the diagnosing leprosy. My question is that's fine that you could figure out how to make such an app, but is it available freely for colleagues in underserved countries such as in Africa?
Actually, Novartis is working on that to make it a free app for underdeserved area. Till yet, no. But many, drug companies, technology companies are working on these apps to make it free for, especially for underdeserved areas. That project focused was in Brazil and India, but in many skin disorders, as you know, we have they are like specific for many poor areas that unfortunately they don't have access to like technology to like train dermatologists. So if we have apps like mobile app that the patients can take a pictures and those apps can make a diagnosis, that would be perfect for people in underserved areas.
Yeah, innovation is really great, and translational medicine is really great. But at the end of the day, the new technology should be accessible for our patients and for the doctors. So this is really a great news that this is under development. So another issue is that we're using AI regularly in the clinical medicine, but how is it in the education? Because we used to teach our students like in the past 100 years. Nothing has changed. What do you think? What is your opinion about how AI will change the medical education?
So AI is set to expand medical education through different options, through virtual reality, through real-time feedback, through expanding virtual tools that we have now. So, for example, in virtual reality, it provides the immersive environment for like medical students and residents to expand their clinical experience. And with many other tools like augmented reality and also with teledermatology, we are expanding medical educations and the need for residents and medical education. For example, if you want them to see like a surgery, they can like have a headset and see all the procedures, and they don't need to be in like real surgery room that may provide and cause many problems for them. So with new technologies, the education is also expanding.
Yeah, but definitely we have to forget these 45 minutes face-to-face lectures, because it's old style. And I think that even students can read everything. This was important when there were no books, or maybe there were books, but no internet and so on. But nowadays, this is probably really not necessary. So, what do you think using AI in medicine, the major challenges? I think that the ethics could be a big issue, because the technology improves extremely rapidly, but somehow the ethics and the regulations may not be. What is your feeling on that?
Exactly. Those are the main concern. And we have other concern like data privacy. The patient consent is another important issue. For example, the biases in algorithms is very important. As you mentioned, having ethical approval is very important for these like AI apps. And it is important to have balance between AI technology and physician or dermatologist insight. And who is the responsible person for example, an error in making a diagnosis? Is that like a clinician? Is it like a technology developer, the hospital? So this is very important issue that needs to be discussed. And also in different continents, we have different like agencies that that set rules. For example, in US, we have FDA. In Europe, you have other organizations. So it is important for all these organizations to sit together, the dermatologists, the AI developers, the policymakers, lawyers. They should all sit together and set some rules for ethically using AI in many skin disorders, also in medicine.
Yeah, another aspect could be when we are using AI for skin cancer detection, and it could happen that lesions that are clinically not suspicious at all, and we, using a dermatoscope, we are more or less sure that it is not a skin cancer. But if the patient receives a report that is a high probability that this is a cancer, it should be removed. And then your physicians will say, okay, but I don't think that the machine has right, and let it there. but probably the patient don't accept your opinion, and the mole will be removed. And then at the end of the day, you will get unnecessary operations. It could be again a little bit a problem using and just believing that the AI diagnosis is great. Another topic, what do you think as an editor of the journal, what role plays in AI in the scientific publishing?
That's a good question. Actually, AI can help us in many aspects of publishing, and it can facilitate many processes like data curation, like peer review process, like plagiarism check. Also, it can check the articles for quality and relevance. And also, it can help us in finding the possible conflict of interest. So those are the advantages of using AI in publication process. But all this process should be under supervision of a scientist, researcher. So the researcher would be the responsible for any errors, for any issues that are in the articles. We can use the technology, but I mean the researcher should be the responsible person for any like errors and issues that may cause and may arise.
Yeah, these large language models can write pretty good papers, actually. There are a lot of publications about the large language models written articles, and it is not really possible to identify whether it is a human or LLM written paper. That is really the problem. And in scientific publishing, the authors should declare whether they were using AI or not. It is not forbidden.
I'm not against the using of the like large language models. Maybe they can give us some outlines, some like hints that maybe we cannot understand or we don't know. But I mean, writing the whole article or whole like thesis with these large language models is not like ethical.
Not
So
ethical
they should
and
be
not
like
allowed.
facilitative tools for us.
Yeah. And lastly, everyone struggles with finding reviewers for the journals. And now a lot of discussion about how to use large language models in reviewing articles. Nowadays, it is strictly forbidden to use large language models for the reviewer to review a paper, because then the intellectual property of the authors will be damaged. So the reviewers must not use it. But there is a trend that probably in 1 or 2 years, some of the publishers will use an embedded large language models that is a closed system, and maybe that these large language models could help us also reviewing. But in this place, I have to call attention for the listeners that reviewers currently must not use large language models in reviewing the manuscripts. So I think, Mohamad, thank you very much for joining to us today. I would like really thank you for being here and sharing your knowledge with us. So thank you very much again, and bye-bye.
It was an honor for me for this presentation and for this discussion with you, Lajos. And it's a great honor for me also to be part of the team. I'm very honored and happy, and do my best to expand and help the whole team for this job that we have in IJD.
Thank you very much again. Bye-bye.